Also, can we get who's all joining in on the phone? I got 402-476. I don't think they can hear me. Anyway, we'll go ahead and just get started. People will be joining in and stuff. So, Cole, if you want, you can go ahead and share your screen.
All right. Well, good morning or afternoon, everyone, and thank you for allowing me the time to share with you about Better Choices, Better Health. Better Choices, Better Health, like Eugene said, is a chronic disease self-management program that SDSU Extension and the South Dakota Department of Health have worked on implementing throughout the state since September of 2014. So this is just a brief overview of what we do with Better Choices, Better Health, what some of the data looks like of people who have participated, and what the future holds for Better Choices, Better Health. So first, what I'd like to talk about is what is chronic disease self-management, or what is this program specifically? It's a program designed to help individuals with chronic conditions gain self-confidence in their ability to control their symptoms, understand how their health problems affect their lives, and provide motivation to manage the challenges of living with a chronic health condition. So many of the diseases that we tackle within the chronic disease self-management program are very different. However, the symptoms are very similar, and that's why this program is so beneficial for individuals who have chronic conditions, is because they oftentimes don't realize that their symptoms are all very similar with other people who are suffering from chronic conditions. So people who have chronic conditions, like I said, have very similar symptoms, concerns, and problems. Chronic conditions often have fear for the future. Oftentimes they're uncertain of where their future is going, what they really can plan for, and what they should be planning for as they go forward. People with chronic conditions must deal not only with their diseases, but also with the impact the disease has on their lives and emotions, as well as the lives and emotions of loved ones. Oftentimes, I've heard many times within these workshops that they're frustrated because their loved ones don't understand or can't communicate with them effectively about their disease and how that is affecting them, because people who suffer from chronic conditions oftentimes are very siloed in their chronic condition, where they only worry about themselves and don't see what is happening to the people around them. People with chronic conditions often feel isolated or controlled by their illness and need an effective support system. This program is very effective in showing people that, hey, you know, we're all different. We all have these different things going on in our lives, but at the same time, we have these similar symptoms, and what can we do with each other to help us better manage that, what's going on? So the basic chronic disease self-management structure, it's a small group of 10 to 16 participants. It's a 6-week long meeting once a week for 2.5 hours. It's always facilitated by 2 leaders. It could be a master trainer, it could be a lay leader. We'll get into lay leaders later and what that kind of means. It complements clinical treatments. It is a scripted curriculum that was developed by Stanford University in Palo Alto, California. So it's scripted and all evidence-based so that you know what you're doing and why you're doing it. It's not disease-specific. We don't focus at all on any particular disease. Just we kind of want them to understand that, you know, you have this illness, other people have this illness, but they also have other illnesses, and it's all very similar. We focus on skill building. We share experiences and provide mutual support. It's a very highly interactive group discussion. A lot of the times it's kind of just as a facilitator, I'm just there to guide their discussion, but oftentimes they lead their own discussions and don't really need my help. It's very cost effective. We have a suggested fee of $10 in which is used to just cover the cost of the book that is supplied to every participant. It's suggested. We don't really force it. We don't really, if you can't pay it, you can't pay it. Nobody's turned away from us. And it's entirely confidential. It's really anything that is said in the group, we expect from our participants that it stays in the group. So the emphasis of our workshop curriculum is not designed to help people learn more about chronic conditions, but rather learn skills and tools to help them better manage those conditions. Some of the things that we cover within these workshops are action planning. We make an action plan at the beginning of every week. Action plans are used to show them that you don't have to have this huge goal, or you don't have to work at just that huge goal, and how can we break that down into smaller steps to make you feel, number one, more successful, but to also show you that you can do certain things in order to reach your overarching goal. Along with action planning, we also do problem solving. So if there is something that occurred during the week that made you not able to achieve your action plan, we problem solve with you and say, well, what can we do in the future when those barriers come up again? We help design an exercise program tailored to the individual. If they are interested, we help them learn more healthy eating behaviors, how to read food labels, how to make better decisions, what a serving size is, what that looks like. We help them manage their pain and fatigue in ways outside of the health provider's office. So we teach them better breathing, exercising, what things can benefit you that will help you better manage your pain and fatigue. We teach them to manage their medications. Oftentimes, and I know personally as a person who does have a chronic disease, that our medications are one thing that is really a huge burden on us, is having to remember to take all our medications, when to take all our medications. Do we have to take them with a meal? Do we have to take them at night? Do we have to take them in the morning? It's just, so we teach them skills on what they can do to learn how to better manage their medications. We teach them how to deal with emotional challenges, and this is one of the things that comes out of this workshop that I sincerely feel is one of the most beneficial, because we teach them how to communicate their emotional struggles with their healthcare provider, with their family, with their loved ones, anyone that they come in contact with, because oftentimes, like I said, it's sometimes forgotten that people can't see our illnesses. And we struggle with how to communicate that, and oftentimes just get angry when people don't really understand. We teach them ways to relax and manage stress. And again, like I said, to communicate more effectively with others. This is something that's really important to me that I drive home, is this workshop really emphasizes communicating well with others and about your illness and what certain things are going on with you. So the chronic disease self-management program's overarching emphasis is to increase a person's self-efficacy. And what self-efficacy is a person's belief in their ability to change their behaviors, their confidence in the ability to exert control over one's own motivations, behaviors, and social environments to carry out a behavior or skill necessary to reach a desired goal, or the degree of belief a person has that they can perform the behavior required to produce a desired outcome. Self-efficacy is crucial to the success of chronic disease self-management. The more self-efficacy people have, the more control they believe they have over their behaviors. Therefore, increasing self-efficacy contributes to the better decision-making processes, stronger motivation, and perseverance. This program really gives people the eye-opening experience to see that you are capable of controlling your illness, and there are things and steps you can do to not be controlled by your illness, but to take control over that and manage it in the most effective way. Proof that the chronic disease self-management works. It was, like I said, developed by Stanford University in the early 1990s. It was first studied in 1996. It's rigorously reviewed. There's over 20 years of data that's been collected by Stanford University that helps with the design and implementation of the chronic disease self-management program. It is supported by the National Council on Aging, the National Institutes of Health, and as well as the CDC. It's being implemented currently in 47 states and 27 countries throughout the world. And there's a 5-year randomized study of 1,000 participants, and that study shows that those individuals who did participate within the study had improved healthful behaviors, improved health status, and decreased the number of days they've spent in the hospital. So there's a lot of different outcomes that come out of the chronic disease self-management studies, and these are just some more examples. Persons who participated in the program compared to those who have not participated in the program showed significant improvements in exercise, cognitive symptom management, communication with physicians, self-reported general health, health distress, fatigue, disability, social/role activity limitations, the number of days in the hospital, the number of outpatient visits. Chronic disease self-management programs results in significant measurable improvements in patient outcomes and quality of life. It is effective across all chronic diseases, and it's effective across all socioeconomic and educational levels. So who is participating? This is as of September 2015 of who participated within the first year of chronic disease, of Better Choices, Better Health being implemented in South Dakota. So as you can see, our participants are predominantly female, and most of them are currently under 60. As you can see, most of them are between under 60, or the next highest is 65 to 69. The educational level, most of them have some college or a technical school, and then bachelor's degree or higher. Most of them live alone, or they live with a disability, or so there's caregivers who don't suffer from chronic diseases, but they have people in their lives who do suffer from chronic diseases, and they are also people who can participate within the workshop. But most of our participants live with some form of disability. Our participants have been predominantly white over the first year that has been implemented. However, we're hoping to change that with the new roles that have been established within Better Choices, Better Health, and getting all of those numbers increased. So the Native American population is what I have been charged with tackling, and I'm hoping that by the end of this year, we will have a significant amount of Native American participants in the workshops. So this chart shows what kind of chronic diseases we have been seeing that have participated within our program. As you can see, the highest number is someone who suffers from multiple chronic diseases. So it could be any number of the diseases you see listed, or it could be different diseases that we didn't have listed on the survey. The next highest is arthritis, as well as hypertension and depression are huge numbers that have shown up for these programs. So who should attend? Any adult that is over the age of 18 with a chronic condition that has the desire to learn skills to cope and manage their lives. But also those in support roles are also invited to attend the workshop as participants, because they give such a unique perspective on what it's like to live with someone with a chronic condition that most people who have a chronic condition don't get the chance to hear. So some of the chronic conditions that we have seen are who are eligible to come, but this is not a limited list. Anyone who suffers from any sort of chronic condition can show up. But there's arthritis, breathing problems, cancer, chronic pain, diabetes, emotional and mental conditions, fatigue, heart disease, high blood pressure, multiple sclerosis, stroke, osteoporosis, or weight concerns. But like I said, this is not a limited list, and we've seen a significant number of other diseases come through our workshops. The Better Choices, Better Health Network is the structure that we work under. So I serve on the Better Choices, Better Health leadership team in my Master Trainer Outreach Ambassador role for tribal communities, and I act as the tribal advocate and advisor to the leadership team as to what decisions we make that will most effectively help our Native populations in South Dakota. I'm also a master trainer. I'm also a regional contact, and I facilitate an action committee. So I'm kind of involved in all of those. But this is just kind of so you can see the structure of who we are, where we all sit. Also, I wanted to, what we're implementing now is what we are calling session zeros. So session zeros are an appropriate way to give your target audience a real taste of what a Better Choices, Better Health workshop looks like. We model some of the activities that we do, show them what they can learn from it, what they can take away from that. We overview the expectations and the anticipated outcomes with the participants. We give the participants the opportunity to meet the leaders or who will be leading the workshops. It's the time where we can answer questions or concerns that anyone has, and it's also a time when they can self-elect to not take the class if they don't feel that it's the right fit for them at the moment. It gives the participants an opportunity to register, and it also gives us, the registration process takes a significant amount of time at the first session. So if we can schedule a session zero to begin with, it just gives us that cushion of time that we don't really have when we're trying to facilitate a 2.5 hour session. When we use session zero, it's always 1 to 2 weeks prior to the beginning of a workshop. 3 to 6 weeks before scheduling a workshop, you can go in and meet with people and give them a session zero so that they have the means and to see, this is what we can talk about to get people registered, different things like that. Or it can be during your regularly scheduled meeting where one of the master trainers or myself or anyone can really go in and introduce the program and show participants what it is that we do with Better Choices, Better Health. Why we use session zero is just to confirm the commitment of our participants. It gives us the opportunity to recruit others who may have an interest. If there's a participant that came to session zero and said, hey, I know someone who would really benefit from this, it gives us that moment to say, great, how can we get them here? It helps us gain support from the implementation site, so we have an active role in where we are implementing this workshop and who we are targeting and talking to. And it helps us facilitate the completion of paperwork. Like I said, the paperwork takes a lot of time, but if we have this session zero, it helps us to get that paperwork rolling so we don't have to worry about it at the first session. So that's all I have. If you would like, you could visit the Better Choices, Better Health website at the Good and Healthy South Dakota website. You can also see it at Stanford University's website at patienteducation.stanford.edu, and my contact information is also listed.
Thank you, Cole. Right now, we will open it up for anyone that has any questions for Cole on Better Choices, Better Health.
This is Whitney. I have a question for you, Cole. What are some techniques that you're using to increase Native American involvement as far as participants in the class?
So what we are doing right now, because and we are literally in preliminary initial, just now getting this introduced to tribal programs and tribal people. So right now I've met with tribal health directors or programs who have reached out to me who would like Better Choices, Better Health on the reservation. So I'm going to reservations and meeting with people to try and get people to sign up and be in these programs, but also finding places who want to implement so I can have a space where people can go, number one, but also looking into finding people who are interested in being lay leaders so that it's within the community, they have the means to just do these workshops and I just help from the back end and doing all the work, the paperwork and the setup and all that kind of stuff. So it's kind of just in the initial getting them within happening within the reservations that I'm working on right now. I don't think I can give you a specific answer on participants per se because we haven't had a workshop yet on a reservation. Does that make sense?
Thank you. Yep. Yeah.
Hi, Cole. My name is Tasha. I just have a quick question about, is there cost to the communities that are doing these classes? Do they need to pay for any kind of licenses or certifications?
Nope. The license is held by SDSU Extension, and they have a license for the entire state of South Dakota to go in and implement the Better Choices, Better Health workshop. So there's no cost. It's really just, you know, someone donating a space where we can meet and then the participants' time. There's no real cost to the program and the person leading the program's time, but we have resources available that help us compensate those people who spend their time in these communities.
Thanks.
Cole?
Yeah.
This is Stella. I was just wondering, from session 0 to the first session, what do you anticipate will be the retention from session 0? How many people show up from session 0 to the, actually going to session 1 and beyond? What do you think that's like?
So session 0, literally, I'm not kidding, just started within the last month that we started doing them, but I've heard from people who have conducted session 0s that they have close to, I want to say 95% retention. So they keep those people that come, but those people also bring other people. So it kind of boosts our numbers and makes it more effective because it allows them to, like I said, self-select out and say, well, maybe this isn't for me at the time, but I know people who can benefit from this. So I, right now, don't know what a hard number to give you for retention, but I think it's pretty successful from what I've heard so far.
Okay. Thanks, Cole. Great presentation.
Mm-hmm. Thank you.
This is Whitney. I have another question. So if somebody wants to implement this in their community, do they contact you? Do they contact Extension? Or who would be...
Yeah, they
so like for the diabetes program in Lower Brule wanted to implement this, who would they contact?
They would contact me. They could also contact Extension, but they would just send them to me. So, I mean, effectively, you could just contact me.
Okay.
And I could, come and visit or send some email or just have a phone conversation, whatever works for them. But either way, whomever you contact, myself or Extension, it'll always come back to me. So.
Okay, send them to Cole. Got it.
All right. So if anyone has any more questions, just go ahead and ask. I'll leave this open a little bit longer, but I have attached the evaluation feedback form on the chat group. So if you can, click on the link and fill out the form on our Community Health Department webinar today, presented by Cole. Thank you, Cole. That was a great presentation.
I have a question.
Question?
I was wondering if the license is in South Dakota, are you allowed to do workshops in other states?
Only if that state has a statewide license and the person is willing to cover you. There's a form that you have to fill out from Stanford in order to make sure that you're covered by some license. So if you went to another state, because North Dakota and Minnesota also have the chronic disease self-management program, and excuse me, Minnesota is willing to extend that. But there's a statewide, and I believe that North Dakota might be just one organization who holds the license, but I'm not 100% sure on that. But there's the capability of going to a different state if need be. You just have to kind of find the resources that are available and kind of partner with them.
Thank you.
Well, this is Tasha. I have another question. Do you, I work for Quality Health Associates of North Dakota, and our South Dakota partner, South Dakota Foundation for Medical Care, is part of, they offer the chronic disease management. Do you guys partner at all?
I want to say yes, and I'm not 100% sure. Is that the same as Quinn, like Quality Innovation Network? Or
Yep, the Great Plains Quinn.
Yeah, we work with them. They're the one who developed our survey. So they are the ones who kind of drive us in getting the data that we need so that they can support us. We also do work with them with the providers within the within South Dakota that they have a network of, and the providers there have advocated on behalf of Better Choices, Better Health.
Perfect. And I just wanted to throw it out there. We're in North Dakota. We do similar work, but we don't use the Stanford model. We use the DEEP model. So if there are, if you're getting feedback from any tribes in North Dakota that are looking for any kind of diabetes self-management education stuff, you can always send them our way, and we can definitely help them. There is one, I think Stanford holds the chronic disease self-management license for North Dakota, but it's only in one part of the state. So just an FYI, if you have anybody in North Dakota that's needing help, you can just send them my way. And I'll send you an email after the presentation with my contact info.
Okay, sounds good. Thank you.
Thank you.
Also, I do have Cole's presentation, so if anyone would like a copy of that, I can forward you a copy of that. I will be putting my email contact information, so if you would like to receive a copy of that, I can send that. Thank you, Cole.
Are we done?
And I believe, well, we do have a half hour left. I'll leave this open a little bit for anyone that would have any more questions. But I want to thank everyone for joining us today, and I hope you all have a great day.
Thank you. Good presentation.